Hi guys. In this video, I'm going to go over the ID list for the cadaver arteries. So let's get started. Remember, this is in your lab folder. It is in APR. So you'll be clicking on the ID list in your lab folder, and that's going to take you over to Connect APR. So let's begin. This is looking at the brain. We are looking at it from an inferior view. What I want to do first is just review a little bit of anatomy here. This is stuff that you learned in AP1. I'm not going to be asking you to identify anything but the arteries in this quiz, but I think it's helpful to get your orientation. So we're going to start with the spinal cord. This is the superiormost part of the spinal cord. And remember, the spinal cord is connected to the medulla oblongata. That's the lowest part of the brainstem, the most inferior part. And also part of the brainstem is the pons. So that's going to be more superior. I do have a couple lobes here, the frontal lobe there, and I also have the occipital lobes. You can see the temporal lobe here. And in addition, here's your cerebellum. So now that we have our orientation, let's go ahead and get started. I'm going to click on these, get rid of these. We're going to start with the vertebral arteries. The vertebral arteries branch off of your subclavian arteries, and they are going to be taking blood to the brain, to what we call the circle of Willis. Be sure that you read your lab handout, that worksheet, because it's going to describe the circle of Willis. It's an anastomosis, and it is used to feed the brain. So here we have the vertebral arteries. We're going to have a right and a left one. So there's the right one, there's the left one, and it's going to feed into this vessel here, which is the basilar, or let's make sure I am pronouncing this correctly.
Basilar artery.
There, don't forget you can do that. Now we're going to go back to the list. So we have this, and that then is going to be feeding into, we're going to now look at the circle of Willis. So the circle of Willis consists of communicating arteries. We're going to start with the anterior one, and that is a really short one right here. And then we're going to have a posterior communicating artery, and you can see it here on both sides. Now these are the two that I want you to know. Now we're going to look at some cerebral arteries. We're going to start with the anterior cerebral. So remember, this is the anterior part of the brain. This is the posterior part here. Remember, your pons are anterior. So this is the anterior cerebral artery. You have one on each cerebrum. And then we're going to have a middle cerebral artery and a posterior cerebral artery. Now let's go back. Remember, I said that blood is being taken to the brain by the vertebral arteries into the basilar arteries, and then we're going to feed into the circle of Willis. You also have another set of arteries that are feeding the brain, and that those arteries are the internal carotid arteries. Remember, these are going to be branching off of the common carotid arteries that we learned in the heart chapter or the heart lab. So the common carotid arteries branches or feeds into an internal carotid artery that goes to the brain and the circle of Willis, and an external carotid artery that is going to supply the superficial tissues of the head. Let's go to activity 2. This is looking at a lateral view of the head. We're going to start with the common carotid here. So remember, the common carotid, this would be the right one. It's coming off of the brachiocephalic trunk, if you learned that in the heart last week. And it's going to branch. You can see a branch coming off here and a branch coming off here. So we're going to start with the internal carotid, that branch. Now follow it. Notice that it's going to the brain. This is how you're going to know. It goes through that carotid canal. So remember, you have one on each side. and then into the brain. Remember that we're feeding the circle of Willis that we just looked at. Here, we're going to look at the other branch coming off here, and that is going to be the external carotid artery. And it's going to be feeding, as I mentioned before, the superficial tissues of the head region. We're going to start with the inferior-most part and build our way up, looking at branches that are coming off of the external carotid. First, we're going to start with the superior thyroid, and this is your thyroid gland right here. This is one of the lobes. Next up, we're going to go to the lingual, which is going to be feeding your tongue. And then from there, we are going to go to the facial. Now we're feeding the face. And you can see that's more superficial because we can see some muscles here that we couldn't see before. And as we continue to go up, we're going to have the occipital. Remember, occipital is the back of your head. So this is going to continue up here and go to the back. And then we're going to have a maxillary, if you remember your facial bones, going here. And then we're going to go up here. It's going to continue up here to the temple. So these are going to be your superficial temporal arteries. Use the names of the bones that you learned before to help you identify these vessels. Let's move on. Looking at, again, the axillary region, your shoulder. So we're going to start with the axillary here. And then I'm going to move backwards to the left subclavian. So right there, you see the anterior scalene's muscle. And you'll always know that this is the subclavian because that muscle is going to be on top of it. Now, we're going to look at vessels over here. So the vertebral artery, if you remember from our first activity, the vertebral arteries feed into the basilar artery that goes to the circle of Willis. So this is going to be the vertebral right there. We're also going to have the left common carotid. See, that's going to be more medial and it's bigger. So right here's the vertebral. So here is the left common carotid. Recall, this is coming off of the aortic arch. And then we're going to have a brachial. So the axillary is going to feed into the brachial. And then we're going to see also a subscapular, which is going to the underside of the scapula. So let's do this quickly. We had the subclavian first, and then once we're in the armpit, it's called axillary. And then when we are in the brachium or upper arm, it is brachial. And then looking around here, remember we have the common carotid right there, left common carotid. Right next to it, you have that small vertebral artery going to the basilar. Here we're looking at the forearm. There's the palm. So this is an anterior view. We're going to start with the brachial artery. There we go. And once we get into the forearm, it's going to branch into a radial and an ulnar. Remember the radius, your bone, is going to be thumb side. So there's the radial artery, thumb side. And then the ulna is pinky side. So here is my ulnar artery. Now, when I get into the hand, remember this is an anterior view. So this is your palm. And so we're going to have, let's see, how do we want to do this? We're going to do a common palmar digital artery. And then once we go to the digits, it is the proper digital artery. And then deep to the common palmar digital is actually the palmar metacarpal. So you'll notice this is a little bit deeper. Now, if we go back superficial, I want you to notice there's a little arch right there, and that is a superficial palmar arch, arterial arch. So that leads, we're then going to have the common coming off, palmar, digital, and then we're going to go to the proper palmar digital. Next activity. It's the same thing. It's just zoomed in. So here we can see thumb side radial artery, ulnar artery. We're going to have superficial. Now, let's go back. Do you see the ulnar feeds into the superficial palmar arch? Then we're going to have the common palmar digital arteries coming off of that. And then you're going to have the proper digital arteries because these are actually in your digits. And now we're going to go deeper. So we're going to remove some of this tissue here. And then you're going to have, so you can see here, it's deeper. You have the palmar metacarpal arteries. Next activity. Looking at the thorax here, we're going to start with the heart. So I'm going to start with the ascending. So let's get our orientation. Here's the heart. This is going to be your right lung. This is your left lung. This here is the diaphragm. And the heart, remember, has the outermost covering of the heart is the fibrous pericardium. So you can see that right here. This right in here, you should know that as the left ventricle. This is the right ventricle. And remember, that's going to be the right auricle that's part of the right atrium. So here is the ascending aorta is receiving blood from the left ventricle. It will then flow into the aortic arch, and you're going to have the three branches coming off of it. The first branch is the brachiocephalic trunk. The second branch will be the left common carotid. And the third branch will be the left subclavian. If we go back to the aortic arch and we follow that aorta as it goes posterior to the heart, it will be called the thoracic aorta. So we've removed the heart here, and this right in here, this is going to be the trachea, and these are the primary bronchi. So you've removed the heart, and you can see this is going to be posterior to the heart. So the thoracic aorta. Now let's go back to here. This is going to be the axillary. I know this isn't subclavian because if it were subclavian, let me click this on here. Remember, we had the scalings. So with the brachiocephalic artery here, or brachiocephalic trunk, that's the first branch coming off of the aortic arch. It's going to branch again here. We're going to have a right common carotid going toward the head and the right subclavian going underneath the anterior scalings. And then when we get into this region, it's no longer called subclavian. It will be called axillary. So here is my right common carotid. Now what we're going to do is we're going to be superficial again so we can see the lungs. So we can see here's the right lung, here's the left lung. These here are going to be pulmonary arteries. So the right and the left. And remember, they're blue because the blood is deoxygenated. It hasn't made it to the lungs yet for gas exchange. You are taking it to the lungs where it will pick up oxygen and become oxygenated. So if it has pulmonary in its name, the arteries are going to be deoxygenated, the veins will be oxygenated, and anything that has pulmonary in the name will be part of the pulmonary circuit. Here's the pulmonary trunk. Pulmonary trunk is receiving blood from the right ventricle, and then it branches into pulmonary arteries going to the lungs. Whoops, I forgot. Here's that anterior scalings. And again, remember, I'm only going to ask you to identify vessels, blood vessels on the test and the quiz. Let's look at the abdomen. So we want to look at the abdominal aorta. That thoracic aorta, still all the same vessel, but it just is given different names depending upon where it is located. It's going to go through the diaphragm. So this muscle right here is your diaphragm. It pierces the diaphragm, and now it goes through your abdominal cavity. And then you'll notice here it branches. Once it branches, it becomes something else, and we'll talk about that in a minute. Let's look at all of these arteries branching off of the abdominal aorta. We're going to start with the uppermost, the superiormost, and that is the celiac artery. And that's a single one. Coming off the celiac artery, you're going to have 3 branches, and I'll show you those in just a minute, but we're going to continue with this view. So then we're going to have a superior mesenteric is the next single one. And then the last single artery, if you keep going down, will be the inferior mesenteric. So you have a superior and an inferior. And again, read about what kinds of tissues are being fed by these arteries. You also have renal arteries. Here's the right one, and there's the left one. So to get your orientation, this is the right kidney, this is the left kidney, this is the spleen, and this is the liver. This right in here, we'll talk about that next week, but that is going to be the inferior vena cava. So let's go back and look at the celiac trunk and what is coming off of that. So we have 3 coming off of that. We have what's called the common hepatic, and it's going to go toward the liver. So it's branching off right here. This would be the trunk there. So here's the liver. You're also going to have a left gastric. You can see here your stomach would be right in this area. And a splenic going over to the spleen. This is your spleen. Notice how splenic is spelled. You only have 1 E. Now we're going to go back to this area here with the liver. So remember we had, let's go back to the common hepatic coming off of the celiac artery. But we also have a hepatic proper artery and a hepatic artery there. If we go back to the abdominal aorta, notice that we have some paired vessels here coming off, and those are gonadal arteries. In the male, they will be the testicular arteries. In the female, the ovarian arteries. And if you go to where the abdominal aorta ends, we have this branch here, and those are called the common iliac arteries. Remember the ilium of your pelvic bone. This is the pelvis, this is the female. Let's look at the iliac. The common iliac arteries coming off of the abdominal aorta will then branch, and you'll have a branch going inward to the pelvic region here with your organs in this area. And this here is going to be the internal iliac, and this would be the external iliac. So this is on your left, and you're going to have an internal on the right with the external, which has been cut. It would be coming down this way. So the internal is going to go into the pelvic cavity. The external is going to continue into your thigh, and once it's in your thigh, it's going to be called something else. So the male, we're looking at the same thing. There's the external there. You can see here, this would be the internal on the left side. This here is the common iliac. This is the left one, and then if we look right here, that's going to be the right one, right in here, where it's been cut. For the foot, remember that the bones of the lower leg, you're going to have 2 bones. Medially, it will be the tibia, laterally, the fibula. So we're going to have a blood vessel that goes anterior to the tibia, and that's going to be the anterior tibial artery. Now, once we get into the foot, we're going to have a dorsalis pedis, and that is oftentimes used to take a pulse. Remember that you have metatarsals as well as digits. So we're going to start with the metatarsals here. So these are the dorsal metatarsals. Remember this, the top part of your foot is the dorsum. And then you're going to have the dorsal digital. And here it's a little bit hard to see, they're a little faint, so go and look at the skeleton here, and then you'll be able to see the arteries much easier there. And then we have an arcuate. Just think of an arc, comes across there. Now what we're going to do is we're going to look at the plantar. Remember, the bottom of your foot is the plantar. So we'll start with a lateral plantar. Here's your little toe. So that would be lateral. We'll have a medial one on the same side as your big toe. We're going to have some metatarsals there. And we'll have a proper plantar digital. And then we're going to have a deep plantar arch. This is looking at a histology slide of an artery versus a vein. This right in here, this is the vein, this is the artery. You can determine whether a vessel is a vein or artery by looking at the shape of the lumen. So in the vein, notice that the lumen, which is the hollow portion of the vessel, is slightly collapsed. It's more oval shaped compared to a nice circular lumen in the artery. So this is my vein. Let's take off the highlight. This is my artery. Take off the highlight. Again, go to the lumen when trying to identify. In addition, each vessel has 3 layers in its wall. We're going to start with the innermost layer, and we're going to call that a tunica intima or interna. So we'll start with the vein. There you see it. It is that endothelium that we've talked about already in class. Here is the tunica intima of the artery. The tunica medium. The tunica medium is smooth muscle and is involved in vasoconstriction and vasodilation. The artery will have a thicker tunica media. And then the outermost layer of the wall is called the tunica externa. That's connective tissue. It's also known as the adventitia. There it is in the artery. There it is in the vein. Now we're going to look at the thigh. Once the external iliac artery goes through the pelvic girdle and is in the thigh, we're now going to call it the femoral artery. Remember, the femur is the bone in your thigh, so it's the femoral artery. And there's a branch that's going to come off of it. You can see it right here. And it's going to go deep, and so that's going to be the deep femoral artery. So notice it's a little bit deeper. They've removed some of the tissue here so that you can see deeper. And then we're also going to have a lateral. Remember, this lateral is going away from the center of the body, and this is going to be a lateral circumflex. Remember, you have a circumflex on the left side of the heart as well, so that means it's going to be wrapping around, so you can see the circumflex there. The popliteal, the femur, or the femoral artery continues down, and when it gets to the back of the knee, it's called the popliteal. Now we're looking at the anterior view there of the lower leg. So here's the anterior tibial. Here's your tibia right here. In the foot, we have what's called a dorsalis pedis. And again, that's what you're going to be using to take the pulse down in your foot. And then down at the digits, you're going to have the dorsal digital arteries. Refer here to the skeleton so you can see that those arteries are in the digits. It's much easier. Now we're looking at a posterior view of the leg. So we're going to start with a popliteal behind the knee. And as that continues, we're going to have some branches that come off. So you see there's a branch there and a branch here. So the first branch that comes off is the anterior tibial. It's going to go around to the front. The second branch that comes off is the fibular, going laterally there. And then as it continues down, the popliteal, as it continues down, will become the posterior tibial. So right in here is the popliteal, and it just, when it gets here behind the tibia, is the posterior tibial. We're looking here at an anterior view. There's the knee. So there is the anterior tibial artery. Here's your tibia. So in here you can see the fibula. So it's running really between the two. We're back at the shoulder. So we're going to start with the axillary. I know this is axillary. Remember, if it were the subclavian, it would be over here, and that anterior scalings would be going over it. So we're in the armpit now, axillary. Once we get into the arm, it's the brachial. There's going to be a branch that comes off of it that's going to go deep, and that is the deep brachial. And then we're going to have the subscapular, which is going to go to the underside of the scapula. And lastly, what we have here is a zoomed in magnification of an artery. Let's look at the different layers here. We're going to start again with the tunica intima, and that is lining the lumen. So this would be the lumen. And remember, this is endothelium. You can see how it's scalloped, partially scalloped, and that's that vasomotor tone that you're going to learn about, where the tunica media, which is the smooth muscle, is slightly contracted, and it creates a scallop appearance. Here's the tunica media, the smooth muscle responsible for vasoconstriction and dilation. And then lastly, we have the tunica externa there with a lot of elastic fibers. So this concludes this video in this ID list. Take care.